Hi, my name is Winnie Zheng. For today's video, I'm going to introduce the topic, which is the environmental and health impacts of lead contamination in Kabwe, Zambia. Today's video is to help us understand the history of lead contamination in Kabwe and identify the most affected areas, and then review the health impacts on residents, particularly children, and last to learn about the cleanup efforts. For today's contents, I will have five figures in total to explain what happened in Kabwe, Zambia. Welcome as we explore the environmental and health crisis in Kabwe, Zambia, a town bearing the scars of a century dominated by lead mining activities. These activities, which began in the early 20th century, have not only shaped the town's history, but have also left a legacy of contamination that endures to this day. In the heart of Zambia, the townships of Kansanda, Makandayama, and Maglulu suffers greatly. As we can see from the map here, the soil in these areas contains lead concentrations alarmingly above the safety limit of 400 milligrams per kilograms, posing severe health risks to residents, especially children, who are exposed to daily through play and other activities. From the table Dangers of Lead Exposure for Children, we could learn that the most vulnerable groups is children under 6 years old. Also, the lead level in majority of Cambodia is over the minimum level of concern in soil as well, showing the table. Next, in this pie chart displays the arithmetic mean blood lead levels in micrograms per deciliter for three townships in Kabwe, Zambia. It shows the proportion of total blood lead level contributed by each township. These levels are all significantly above typical safety threshold, indicating severe lead exposure among the residents of these areas. For instance, for Kansanda, the highest average blood level at 82.2 micrograms per deciliter, representing 46.1% of total measured blood level. This coming line graph shows the mean blood levels in micrograms per deciliter for three age groups. The data indicate a decrease in trade in blood lead levels with increasing age. In the age group of 0 to 3, the youngest age group has the highest mean blood lead levels at about 32 micrograms per deciliter. The graph suggests that younger children in Kabwe are exposed to higher levels of lead compared to older children. For Figure 5 listed here, corresponding to previous blood lead levels by township chart, we can note that there are lots of clinical effects related to the blood lead level above 40 micrograms per deciliter, such as severe brain damage for children. Then efforts to address this contamination began around 2015 with soil replacement and public health education initiatives. Despite some progress, the cleanup has been slow, and the scale of contamination requires a more robust and continuous response. In summary, Kabwe affected by extensive lead contamination due to historic mining. High lead levels persist in soil, especially in Kansanda and Maglulu. Significant health risks for children, especially for 0 to 3 years old, with many exhibiting dangerously high blood lead levels. Also, there is a correlation between high lead exposure and severe health outcomes. Lastly, cleanup efforts initiated but need more robust support and acceleration. As we reflect on the situation in Kabwe, it becomes clear that much remains to be done. The health and environmental repercussions of a century of mining cannot be overstated, and the need for an intensified cleanup efforts is urgent. Here's my reference. Thank you.